Ways to prevent diseases. This is a project that is going to be presented by Anik Gloria Oitonse. Here first see the outline. In the outline there is a comparison of the leading causes of preventable diseases. We're going to see the overview of the 7 dimensions of wellness. We're going to see the strategies to reduce preventable diseases. Leading cause of death in United States. These are 4 diseases. There is heart diseases, there is stroke, there is cancer, and there is respiratory diseases. Leading causes of preventable diseases. So when you say preventable diseases, is a disease that someone can keep from happening. For instance, if you say like heart diseases, what kind of things can I do just to prevent it not happening? Cancer, what can I do? What physical exercise can I do? Or what could I eat? Or just something that I have to avoid. So it's like you are preventing something not to happen. So first we're going to see heart diseases and stroke. So heart diseases and stroke are remaining the first and the third leading causes of the death in the United States. They say that some risk factors include the high blood pressure, high cholesterol, heart diseases, diabetes, overweight, previous stroke, there is a tobacco use, there is alcohol use, and the lack of physical activity. So it has been seen that by World Health Organization 2010, the cardiovascular diseases death was 17 million deaths in the United States. So it's a high number of people. Let's go to cancer. Cancer kills around 7.6 million in the United States of America, and cancer has been continued just to claim more than 500,000 lives each year, and it remains the national second leading cause of death, as said by who? By World Health Organization, of course. So in the United States of America, it has been seen that African Americans are more likely to die of cancer than people of any other racial or ethnic group. So let's continue and go to the respiratory diseases, which is another preventable diseases. So these chronic respiratory diseases include there is tobacco smoke, as also cancer or heart diseases. There is secondhand smoke exposure. There is other indoor air pollutants. There is outdoor pollutant agents, and there is exposure to occupation agents. So respiratory diseases such as asthma cause 4.2 million deaths in the United States. So it's also a high number. There's diabetes. So in the US, 24 million Americans have diabetes. So you see that if 24 millions of people now have diabetes, it's a large number of people. And diabetes leads to kidney failure. There is non-traumatic lower extremity amputations and blindness among adults. So you may understand that diabetes also is leading to a high number. So there's something that we can do just to prevent it. If we know where it comes, if we know the causes of these diseases, it's where we can also find the way to avoid it, or we can prevent it not happening. Leading cause of preventable diseases. According to the World Health Organization, there are 3 factors that lead to the preventable diseases. These are behaviors risk factors, background risk factors, and there is intermediate risk factors. So behavior risk factor include that the lack of physical activity, there's a poor nutrition, there is tobacco use, and there is drinking too much alcohol. So when you go to the background risk factor, this consists of age, consists of sex, consists of genetic composition. So when you go to intermediate risk factor, you can call it again psychological changes. So this is exists or consists with the increase of blood glucose. There's the raised cholesterol. There is obesity, and there is also the increase of high blood pressure. Let's go to the leading cause of preventable diseases that are found in the United States and worldwide, of course. So obesity, high blood pressure, and unhealthy diet, it's one of the leading causes that cause preventable diseases. So Americans eat a large amount of fast food, which is an unhealthy diet, of course, and which is lead to the high blood pressure, and that cause obesity. So, according to the Goodman Allen article, U.S. citizens spend like $200 billion a year on these fast foods, which shows that it's a really a high number of population and a high number of money. So it means that every day 1 in 4 American eats at a fast food restaurant. So it's a large number, and that's where there is an increase of these preventable diseases. There is what we call insufficient physical activity. So as indicated by WHO or World Health Organization, around the world 2.2 million people die each year due to the physical inactivity. So if people don't do like exercise, don't do physical exercise like swimming, they can go for jogging. If they don't do it, now there is is that it leads to the preventable diseases like maybe respiratory diseases like heart attack, cardiovascular diseases, and other preventable diseases. There is what we call also cigarette smoking. So this cigarette smoking kills more than 400,000 people, Americans, each year. And now, when you go to the worldwide, the highest incidence of smoking among men is in the lower mid-income countries, while for the total population, smoking prevalence is highest among upper middle-income countries. So you see that it's something that it's a cause that leads to the preventable disease, but there's something that we can do to avoid this, so that the preventable disease cannot happen. There is the raise of blood pressure. So this is also one of the major risk factors that causes preventable diseases like cardiovascular diseases. So the prevalence of raised blood pressure is similar across all income groups. For instance, actually, there is a general lowest in a high income population. I do remember when I was working on aging, I found that in the United States, a handful of adults have this problem of blood pressure that is increasing. So you see that it's something that we can prevent, which leads, of course, to the preventable diseases. So it's a leading cause. So there's something that we can do so that we can avoid these causes, so that it can lead to preventable diseases. So now we are going to another part, which is the overview of the 7 dimension of wellness. So wellness, I take it like a way of being healthy in different dimensions. So it's going to be now in different dimensions as it was seen by fitness and wellness. In physical, it's going to be intellectual, it's going to be emotional, social, spiritual, environmental, and occupational. So this image displays well the spiritual, physical, intellectual, occupation, social, emotional, and environmental dimensions. Now let's go and start to the physical dimension. Physical dimension, it's all about the function of the body. For example, by like doing physical exercise, get adequate rest, get a proper nutrition, knowing your body, like knowing your body checkup. For instance, I say now I have to go to the dental checkup, I'm going to the eye checkup. So if you know really your checkup, your body checkup, it's about having a good physical body. So that's why it is in a physical dimension. Going to the intellectual, it's all about the function of the mind, or I can say it's about like using mental activity. Yes. So or we can say that if you say you're using mind, that is the ability to think. So this is because when you say that our body need exercise, it's also good, or it's also better that our brain also need exercise. So in this dimension, you have to engage your mind into creative, such as thinking critically, analyzing, and evaluating. For example, you can learn a new language, you can read. When you say you can learn a new language, maybe you don't know Spanish, so it's your time to learn a new language. Maybe you don't know Spanish, Chinese, you can learn Chinese. It's a way of helping your brain to work. You can read, or maybe you can find someone to challenge you, because when someone challenges you, it's when now your brain starts working, your mind is just working well. So let's go to Emotional dimension, it's a kind of creating, it's a way you as we know the definition of emotion, so it's a way of creating feelings. So it means that you use your emotion. For instance, when you are happy, you laugh. When you're anger, when you're sad, when those are like feelings, all those emotions that you show to someone. So here in emotional dimension, you can share your feelings. For instance, you can forgive someone or forgive yourself. You can seek and provide support. That's all about the emotion dimension. Let's go to social dimension. Social, it's all about how you meet and spend time with people. Because when you say social, for instance, when you are home, you collect your brothers and your sisters, you collect your mom, so that's love. Or what you see, you talk with others. So we say social, it's all about like meet with the different people, appreciating what others do or appreciating their uniqueness. Yeah. So they say in social dimension, we live up our expectations and demands of our personal duties or our personal roles, and we learn how to help others, how to contribute to the community, interact with others, and how you can share your thoughts or your ideas among others. That's all about the social dimension. And then let's go to the spiritual dimension. Spiritual, uh, when someone tells me about spiritual, I understand like what comes first in my mind is about religion and belief. So according to the fitness and wellness article, spiritual dimension involves the personal search for meaning and direction in life. So it involves getting beliefs, principles, and values that provide strength through all of life experiences. So sometimes in this dimension, people appreciate things that they cannot easily explain or hard to understand. So that is why you can say that is why it's important to spend time alone doing different things. For instance, when I'm tired, and just go uh, and then make a meditation. In that state of meditation is where I'm just alone, and then I start to remove all things in my mind. So that's also one important thing of spiritual dimension. And here you can explore your spiritual core. So going to environmental dimension, it's all about the preservation of natural resources by protecting the physical environmental, which include plant and wildlife. It's all about also taking care of water. There is air, there is soil, uh, and other. So and you create different harmony by reducing different detrimental things or detrimental effect to the environment, of course. So here, for instance, you can reduce the use of chemical products. So here you can talk about the industry that release different chemical products. You can do the recycle. You can make like conserving electricity and conserve water, because it is really important to our life and our body. That's all. That was all about environmental dimension. Now to occupational dimension. Occupation is all about delivering personal satisfaction from your vacation. So in this dimension, you make the use of your talent and skill just to be happy or get satisfied, and people can just do it because people, when they have money, they have talent, they use it to get money. So it's kind of also of getting satisfied. So the occupation dimension involves a work environment. For example, you can explore career option, or you can choose a career that suits your personality. Yeah. Now here going the strategy to reduce preventable diseases. So according to the National Center of Chronic Diseases, Prevention and Health Promotion, 2009, there are more strategies that they just give different strategies that can help or to reduce preventable diseases. There is school-based strategies. They say that this strategy foster environments and instructions that promote health. For instance, eating, daily physical exercise, avoiding tobacco, drugs, and different alcohol. There is smoking cessation strategy. This is really important because it will improve the access to cleanliness, it will improve the assurance coverage of smoking cessation services, and get greater involvement of the health provider and healthcare system in the routine delivery of cessation advice and services to patients who want to quit smoking, which will be a good strategy. There is the outreach strategies that will ensure that the old adults have access to various programs, with, like, for instance, with science-based measures to prevent diseases and malfunction and decline. There is also a better training and education to the healthcare professional. This will be, it's a good strategy because it will help those health professionals to be able to use different materials in medical practice, or to be more encouraged, or to know more about what is used in the medical practices. There is urban design and land use strategies. This is really a good strategy because it will lead to an increase of physical activities. Uh, like, for example, I can say the change of transportation and travel policy. That's about the strategy to reduce the preventable diseases. Now let's continue. There is implement programs that foster health living across life stage among disadvantaged group. There is also creating equitable access to effective screening and diagnosis tool for breast, there is cervical, there is collect, there's colorectal cancer, there's diabetes, there's high blood pressure and high cholesterol. There's different national and now here is that different national agents can provide essential technical assistance and scientific entrepreneuring to support state and local programs. This will be important because when someone is sitting here and read this kind of articles or different national agencies helping us, it is a good strategy to help different people to know more about different programs or what's important to really our life or what we can do to prevent those diseases. So here was the reference of where I get different information. So for more information you can visit the reference page. So thank you.